And with the crisis receiving center coming to Prince William County, the county has an extra focus on mental health care. How does something like the center help your mission?
Oh, it's just tremendous because we have, as I say, we have a helpline, we have the support groups and the educational programs, and families always come to us with horror stories about the needs of their family members not being met. The same thing goes for peers who have sometimes terrible outcomes because of misplaced responses to their crises. It could be a response from the police. It could be a response, a negative response in a hospital emergency department. Um, and that's why this provider education is important. That's why we assist with crisis intervention team training for police. And there have been great improvements in Prince William County. So the fact that our officers and jail staff and others who interact with folks with mental health conditions in the criminal justice system. We have an excellent crisis intervention team training that's done by the county, and we participate in that. And there is now a co-responder team in the county, which a mental health professional from community services rides along with a police officer as backup. But again, it's the mental health therapist who is the lead on responding to a call. And then, of course, in more serious situations where weapons and imminent threat of suicide are involved, where police response is still called upon. But we know that sometimes those outcomes are not good. You know, it still may end in suicide, tragically. We've had cases involving adults and youth alike. But the Crisis Receiving Center concept is part of SAMHSA's National Crisis Now model. So SAMHSA is the Substance Abuse Mental Health Services Administration, and they have come up with a national model called Crisis Now, and it addresses mental health concerns across a continuum. We call these intercepts. So sometimes the first level will be simply someone seeking assistance, information, and 988 is a service that can provide basic information and referrals. The next level is, let's say there's something actively going on and the person can't get an appointment with a doctor. So a mobile crisis unit, and there are two types of crisis units that are available that can come to people's houses. And that obviates the need for calling police. So many families are happy about that. And then the next level, of course, is a co-responder team. And then sadly, sometimes it does require that police response. But the neat thing about this crisis receiving center is that even though our community services is trying to offer what they call same day access, it's still very hard to get an appointment right away. And you may know, your family may know that sometimes you really have to strike while the iron is hot. And if you have a family member who's willing, they finally got to the point where, hey, I really do want to do something about the way I'm feeling, please help me. And you can't get an appointment, and you can't get in to see community services, which is of course, our first line governmental response agency. I've been through situations like this. We had an incident experience a number of years ago in which we had to wait in desperation after her son had been arrested, actually. And we were still trying to get mental health care. Even though he'd been arrested, we still couldn't get him care. And we finally found a doctor who would take him. His situation was complicated because he not only has bipolar disorder, but co-occurring substance abuse issues. And at that time, most, for example, the hospital, Prince William Hospital in Manassas, would not treat anyone with a mental health condition who had co-occurring substance abuse issues unless they had been substance free for 6 months. So the hospitals turned us away. And I finally found a doctor up in Arlington who was willing to see him, but it took 6 months to get an appointment. So we were just on tenterhooks trying to keep our son out of the criminal justice system, and out of total breakdown, a crisis, for 6 months, and we were not successful. It was a horrible, horrible time. So this crisis receiving center means that my family, in that crisis mode back in 2010, we would have been able to take our son directly to a crisis receiving center and they would see him right away. We would not be turned away. It would be an open door. It would be life-changing for families like ours. And I know that we are not the only ones, because I hear from people all the time about the crises that they're dealing with. So that crisis receiving center means that my family could bring our son in, that an individual could walk in off the street and say, hey, I've run out of my medications. I'm decompensating. Things are getting awful for me. What can I do? And they will have a pharmacy on site and can provide the medications that the person needs and the support that they need, to stabilize. Also, if that individual, we know that we have two so-called crisis assessment centers. One is at Sudley North and one is at the Ferlazzo building. That's another place where police can drop people off. But they only have capacity for one person at a time, and it's only short term. It's no more than 23 hours. And if they can't find a place to treat them, a hospital bed, the person is gone again. Police are so excited about this crisis receiving center because instead of taking people either to jail, or to the ER and waiting for days in an ER, because we know that ERs use triage. They're going to treat the person who is bleeding, has a heart attack, a stroke, broken bones first. The mental health condition, because they're not presenting with that physical condition initially. They may be, but not usually. They're going to wait for sometimes days. And if the police brought them in, the police have to wait there days. And so our police are very happy that they're going to be able to get their officers back on the street, because instead of taking them to the ER or to jail, they can take them to the crisis receiving center, drop them off at a separate entrance, and within 5 minutes be able to get back to their real job, and be back on the street serving our residents here in Prince William. Not sitting in a hospital ER with a person with a mental health condition. So we are very, very excited about it. We know that it's not going to be resolving all problems, because we still don't have enough long-term mental health beds in the state of Virginia. The state has a big problem, and I know the one hospital that does have mental health beds here in Prince William, which is now UVA Health, they are not able to operate at capacity because of the severity of the patients that they are receiving now. These are patients who previously would have been admitted to a state hospital for a forensic clearance, forensic care, and the state hospitals are overwhelmed as well. So again, it's the crisis receiving center for folks with serious long-term mental health conditions. It's not going to resolve all of their issues. And it's not going to resolve all the long-term issues that we have in terms of housing. Yeah. So we have a huge need for permanent supportive housing for folks with very serious mental health conditions. Because not everybody is like you who is living in recovery. There are some folks who will have lifelong difficulties because their mental health condition has affected them cognitively, and they're not able to hold down a job or function without support. So we have a huge need for permanent supportive housing. That's a great unmet need. So their crisis receiving center won't resolve all of our problems, but boy, it will help some major problems. So that's why we've been so very actively advocating for it. Our Board of Supervisors have seen how important this is. They've heard from the police, they've heard from the Hospital Association, they've heard from Community Services. And another great organization that has joined our advocacy is VOICE, which stands for Virginians Organized for Interfaith Community Engagement. So, and that's composed of congregations, mosques, and synagogues. So faith leaders who have been stepping up along with their congregations to demand better mental health services for everyone. So again, it's been a big coalition coming together. The advocacy efforts are not complete. We're still trying to get an additional $2 million in funding for the youth wing at our crisis receiving center. And then we'll need to make sure that both the state and the county provide ongoing funding for that crisis receiving center. But we're very excited about it. So pleased that the county purchased the building in which the crisis receiving center will be housed, and that the county will be able to co-locate other agencies that will be serving folks with mental health conditions in the same building. So crisis receiving center is just wonderful, not the cure to everything. We need a cure for mental illness.
Right.
That's what we really need. But anyway, it's a big step in the right direction, and I'm so pleased that all these advocates have pulled together to support it. Prince William County can be proud of itself.
My name's Nikki Jennings, and I'm the Operations and Resource Coordinator for the Virginia Breast Cancer Foundation.
Can you tell me about the foundation?
So we are a local nonprofit that's based out of Richmond, Virginia. We're very grassroots, pretty small staff, but we've been around since 1991. And we do all kinds of great stuff for the community, from sending out free educational materials. We also provide free support kits for folks who are either newly diagnosed, metastatic, or their friends, family, caregivers. So we do have caregiver kits available as well. Another great thing we've started in the past couple years is our diagnostic fund, which actually will help cover the additional costs for folks who are uninsured or underinsured that need additional testing to basically get their diagnosis. So sometimes folks might get a mammogram and have maybe some sketchy results, but they may need some more testing to actually be able to form a plan moving forward. So that's one of the great programs we started in the past couple years. We also have several events throughout the state. We've got the Pink 13.1 walk, which is down on the Virginia Creeper Trail. And then this year we've changed our More Than a Pink Ribbons award ceremony to a learning session beforehand. So we're doing a healthcare summit before we move into the award ceremony. So that's going to be later on this month. But we go all over the state. You can go to our website, vbcf.org, and request a speaker, request a resource table like mine today, free educational materials, support kits, all that good stuff. We also have a lot of great content on our website as far as blogs. We do a lot of advocacy on the state and the national level, so you can sign up for our advocacy alerts and also find out just how you can volunteer and get involved.
How does it feel for you that you are helping people going through it?
That is truly an honor to me. I actually have been a sole caregiver for my mother when she was dealing with different health issues. So just from going through that hard experience, I really wanted to come on board with this nonprofit to be able to kind of be that person who just is just there if you need to talk to someone. I can find resources for you if you're looking for financial help that might be available out there, and just general support. So it's been just wonderful to be able to give back in that way, because when I was going through that as a sole caregiver, I know it can be very overwhelming, very scary, and sometimes you just feel alone. So that's my job, is to, just try to let everyone involved, whether it's the patient or the family, know they're not alone in this, and there's a lot of people that care out there.
So with helping others, what do you do to help your own mental health?
You know, that is a great question. I'm so glad you asked that, because a lot of folks in my possession or, nurses, hospice workers and whatnot, we give so much and we often forget to take care of ourselves. So this whole process and just meeting other folks who do similar jobs to me, we do have opportunities to meet and, kind of get together and discuss our issues every once in a while and just learn different ways to cope. So whether that's just being gentle with yourself, knowing when to set your boundaries, knowing when you need rest, it's great to be able to have a flexible schedule, because then you kind of can gauge, especially in the busy month of October for Breast Cancer Awareness Month, when you can pause and when you can go. So I just recommend everyone to, have your boundaries, make sure you're gentle with yourself, and just try to remember that you're doing something great, as much as it can be overwhelming and feel like, there's always a goal up here, but, little steps at a time every day. And you can be happy knowing we're pushing that boulder forward.
How can people reach out?
So you can reach out to us by going to our website. That's the best thing. It's like a huge, awesome hub of anything breast cancer resource in Virginia. So our website, for the Virginia Breast Cancer Foundation, it's www.vbcf.org, or you can always email help@vbcf.org. And our phone number is 800-345-8223. So you can call us anytime, and we have several different staff members. Myself, I mostly do packages out, sending educational materials, and then, coordinating our resource program. But we also have an education manager and a woman who basically does all of our great advocacy work. So even if you're a survivor and you want to get involved, we would love to have you share your story with us. We can get you connected with your representatives during those lobby sessions and whatnot. We like to do a lot of that work too, and just be able to amplify the voices that should be heard.
My name is Kathy Wales, and I am Zach's mom, so we have Team Zach for the walk.
Why is today important to you?
Today is important to me because 6 years ago we lost our son to suicide, and AFSP provides a lot of resources for people that we didn't know about when we were going through the immediate after effects. And it's important to me to raise money for AFSP so that other people can have those same resources, to continue to have those same resources, but also because we want to make sure that we can raise awareness so that people know about them, because we didn't know at the time. And we want to, number one, raise awareness, and number two, to help end the stigma, and number three, to help keep this going. I'm also a nurse, and so it's important to me to make sure that people know that we have mental health resources available. And we're also both veterans, so we've been affected on a couple levels, but it's a very worthwhile cause.
Can you tell me about Zach?
Zach was 20 years old, and he was a wonderful boy. He was a leader in the church. He'd been on he was about to go on his 10th mission trip. We lost our younger son to a very rare disease in 2016, and 9 months later we lost Zach to suicide. He had the same disease, and he knew what he was facing, and he didn't want to have to go through what his brother did, and so he took his own life. And I know a lot of people get angry at their loved ones for leaving. I just hope he's found some peace. But we have a lot of people that still support us, and we're so thankful for that. A lot of friends, a lot of family. And even though they might not be here because we've lived in several places, we've had a very good friend of ours who walked in North Carolina yesterday, and he videoed it and he put it on Facebook, and so we shared that. He walked for Zach and for his own struggle, and it's just been it's a good experience to come out here, but But Zach was the kind of kid that people come up to you and say, hey, you know, your son really helped me with this. Hey, you really helped me with that. Our neighbor told me that she had a flat tire and Zach pulled over to help her. And she was going to give him some money for helping him, and he had already left. You know, he was just that kind of a person who would help you, and he didn't want anything for it. He was very interested in building trades, and he had become an electrician, was very good at that, and we were very proud of him for that. And he was just a wonderful boy. He loved his big black Dodge, and he loved camouflage and country music, and I think it says a lot about him that he still has several friends who come out 7 years later to support him at the walk and to remember him.
How does sharing Zach's story help your own healing process?
I think it helps us to try to make resources available, to know that no one else will have to, or in the hopes that no one else will have to go through what we went through. That if there is a program out there in a high school or on a military base that does affect someone, even if it keeps one person from taking their own life, then I think it'll be worth it. Because all we can do now is try to help prevent other people's losses. We can't bring him back, but we can try to help other people. And that gives us a purpose and something to feel like we're doing constructive towards ending suicide.
I've always been told I gotta be strong. Thick skin, tough as nails. But to be everything for everybody, it wears on you. Black don't crack, they say. But it can. We all can. Reach out to a friend if you see them going through it. No matter who you are, being vulnerable is what makes us whole. Learn how to help at seizetheawkward.org.
I know you've been grinding. I know things aren't easy. I wonder if you know that we can get help. Love, your mind.